celebration of cultural diversity for massage therapists, a 1 hour or 1 contact hour continuing education course for Maryland massage therapists or any massage therapist across the nation. I'm Robin Anderson. I'm the program director for the CCBC Massage Therapy Program at the Community College of Baltimore County. So I welcome you to this unique online course that you can take for your continuing education credit. So this course, as I mentioned before, has some online components as well as our discussions with video. But what I want to do is introduce you to Amelia Mitchell from Alchemy Healing Arts Center in Annapolis, Maryland. And she's going to join us in the discussions about cultural diversity. So welcome, Amelia.
Thank you. Glad to be here.
So tell me a little bit about yourself.
I am the owner of Alchemy Healing Arts Center in Annapolis. I've been a licensed massage therapist now for about 14 years. At this point, my path has expanded to, or narrowed, and I am a lymph drainage therapist specifically most of the time. And over the last few years, I've done more and more teaching and ethics, cultural diversity, practice building, all of those things are some of my favorite things to talk about.
Great, and that's why we have her here today to talk about cultural diversity. So let's kind of jump into this a little bit. So tell me about your experiences with diversity as a massage therapist. I mean, reflecting on your experiences with your clients, what kind of experiences have you had?
Well, to start out, it's really important that I state who I am and what point of view I'm coming to things from, so to speak. So my name is Amelia Mitchell, obviously. My pronouns are she and her. I am a cisgender queer woman. That's how I describe myself, so that's how I function in the world. And what that does is it names some of the intersections that I have with other people. Mm-hmm. And it tells other people a little bit about who I am, and we'll talk about some of that language as we go on.
Okay.
But that's a good place to start. Within the treatment room and within my practice, I've worked with pretty much most every category you could discover for talking about diversity. And most importantly is I've worked with a lot of individuals, a lot of people, and how we treat people matters, especially as massage therapists and especially in terms of creating a safe space. And I know we'll get further into that. Mm-hmm. However, there's some basic things that inform how I work with people, and understanding things about different categories of people is very important. Different ways people move in the world, it's really important. And it allows me to be more compassionate and more understanding and simply be a better therapist. So yes, I have had the opportunity to work with a lot of people. However, I will always be doing that as a cis white woman. Mm-hmm. So I will never be able to fully have the experience of a young man of color or a Muslim woman or any other categories that we can fit in.
Right.
However, I can do my best to understand the world that they live in and some of what their challenges are in this world. Mm-hmm. And that's what I hope we can, help out a little bit with it today.
Yeah, absolutely. So when we think about diversity, we're thinking more in terms of gender expression, ethnicity, as well as other cultural identities that can potentially just play into how a person identifies or presents themselves as an individual. Mm-hmm. So, and we talk about, as massage therapists, creating that safe space for them. But, we sometimes bring our own biases into that room, don't we?
We do.
So, and we have to be aware of that as well. So I'd like to kind of bring up the whole concept of generalization versus stereotype, because I think that really fits in terms of the role as we are as massage therapists going into the room, and then maybe looking at it from the flip side in the next segment about the safe space.
Exactly.
So, okay.
Well, a generalization is a way to understand people or a culture. A stereotype is instead of a broad understanding, a stereotype is a very narrow view of people, a culture, a race, things like that.
Mhm.
So a good example that I have used is that within the Korean culture, kimchi is a food that is enjoyed by many.
Mhm.
This is a tiny tidbit of a cultural understanding about the Korean culture. There's vastly more than that. However, that is a generalization. Many people who are Korean enjoy kimchi. A stereotype would be everybody in Japan eats sushi all the time.
Mhm.
That's just not true.
Right.
And that, instead of expanding in a broad look, is a very narrow look, and it comes off as kind of judgmental and inappropriate.
Right, absolutely.
And it comes off as, I know all of this about all of those people, which again is completely inappropriate. So there are times when we do make generalizations about groups of people, and that helps us understand better, and that is perfectly appropriate.
Mhm.
It's when we take a tidbit of information and layer that all over an entire group is when we get into trouble.
Yeah.
And that's the stereotype, and that's when we are not actually welcoming diversity, we're actually
Yeah.
closing it off.
And I've actually experienced that from the client perspective. Early in my practice, I used to work with a lot of elderly clients. And, you have military folk that maybe went overseas and fought in many of the world wars or Vietnam War, Korean War, so forth. And it's all in their experience is what tends to influence their stereotype or their generalization factor. So I know we were talking about this in the ethics one, but how that's very difficult to manage that. But understanding that that's your client and that's their perspective, may not necessarily be ethically right, and definitely doesn't embrace cultural diversity in any way, shape, or form. But again, it's meeting your client where they're at and realizing that that is potentially present in interacting with others.
Because we can, I'm sorry, I didn't mean
No,
to
no,
interrupt you.
that's okay.
We can generalize that a lot of veterans of foreign wars
Yeah.
may have very specific
Yeah.
experiences that have caused them to stereotype
exactly.
different communities, but we don't have to take their stereotypes as new information
Right.
to feed our generalizations. We can hold that from a bit of a distance,
Right.
and not jump in or not take it as new valid information.
Right. And we experience these things also within our own families and within our own social settings. So when we, being aware of that, I think, is incredibly important.
And one of the pieces that I have done and come back to repeatedly in my own personal work, because this is frankly personal work, is you don't know you don't know.
Right. No, that's a good phrase.
You don't
Yeah.
know you don't know what you don't know. And if I think I know everything about a group, a population, or something like that, or I understand everything that I need to know about this situation, I'm pretty sure if I've gotten to that point, I'm about to really flub it.
Yeah.
I am always better off, especially in a client situation, if I am not sure, asking a question.
I was just thinking that really you can't know everything about every type of culture, how people react to gender, how people react to certain religions and so forth. So if you don't know, then just ask.
It's much better to
Yeah.
ask a clean and valid question. Was working with a larger client the other day. That's a whole nother area.
Right.
We have size diversity in
Yeah.
bodies.
Mhm.
Working with a larger client, I'm a larger client. Asking them specifically, is this comfortable for you?
Yeah.
Is not making assumptions. It's not stereotyping them in any specific way. It is meeting and being aware that they are somewhat different in a way that I actually do personally understand, but you might not understand.
Right.
So that can be done with respect, it can be done with openness, it can be done with a willingness and an interest in learning. And I know when people approach me from that point of view, I'm happy to share.
Right.
When people are like, oh, I don't know how you're gonna do this, or you can fit on the, just don't know, that feels, that doesn't feel so good.
Right, exactly. So definitely, making sure that having an awareness is a good idea of a generalization, but not being influenced by stereotypes is probably the best way to look at this.
Exactly.
All right. So we've kind of addressed the topics about how to handle or how to identify cultural diversity. In our next segment, we're going to talk about the safe space. So stay tuned.